Have you noticed that many older adults don't sleep like they used to? They go to bed early, but wake up at 4 or 5 in the morning. They fall asleep faster than before, yet wake up multiple times at night. And even after sleeping for hours, they still feel tired. So what's really happening? Is it just normal aging? Or is something changing deep inside the brain? Today, we're going to explore why older adults sleep less, what's actually happening inside the body, and which sleep changes are normal and which are not. Sleep changes with age. Sleep doesn't stay the same throughout life. In childhood, the brain needs long, deep sleep to grow. In adulthood, sleep helps repair the body and regulate emotions. But as we age, the structure of sleep itself changes. Older adults spend less time in deep sleep, wake up more easily from noise or movement, experience lighter, shorter sleep cycles. This isn't because they need less sleep. It's because the brain becomes less able to produce deep sleep. Deep sleep is the most restorative stage. It's when the brain cleans waste, repairs neurons, and stabilizes memory. As we age, that stage becomes shorter and weaker. So even if an older adult sleeps for 7 hours, the quality of that sleep is often much lower. The aging body clock. One of the biggest reasons older adults sleep less is a change in the circadian rhythm, the body's internal clock. This clock controls when you feel sleepy, when you feel alert, when hormones are released. As people age, this clock shifts earlier. That means feeling sleepy earlier in the evening, waking up earlier in the morning, difficulty staying asleep late at night. This is why many seniors wake up before sunrise, even if they don't want to. It's not insomnia. It's a phase shift in the brain's timing system. Unfortunately, modern life doesn't adjust to that shift. Early bedtimes plus early wake-ups often lead to fragmented sleep and daytime fatigue. Melatonin decline. Melatonin is the hormone that tells your brain it's time to sleep. As we age, melatonin production drops significantly. The pineal gland, which releases melatonin, becomes less active. This leads to trouble staying asleep, more night awakenings, lighter sleep overall. Even worse, older adults are more sensitive to light at night. A small lamp, a TV screen, a phone notification. All of these can suppress melatonin even more. That's why sleep becomes easier to disrupt and harder to recover. The brain ages too. Sleep is controlled by the brain. And like the rest of the body, the brain ages. Key sleep-regulating areas, especially the hypothalamus, lose neurons over time. These neurons are responsible for maintaining sleep depth, switching between sleep stages, preventing frequent awakenings. As they weaken, sleep becomes lighter, more fragmented, less efficient. This is not a disease, it's a biological change. But it explains why older adults often say, "I sleep, but I don't feel rested." Nighttime awakenings. Another major reason older adults sleep less is nighttime awakenings. Common causes include needing to use the bathroom, joint pain or stiffness, acid reflux, breathing changes, temperature sensitivity. Each awakening interrupts the sleep cycle, and as the brain ages, it becomes harder to fall back asleep. What used to be a quick return to sleep can turn into long periods of wakefulness. Medication and health conditions. Many older adults take medications that affect sleep. These include blood pressure medications, heart medications, antidepressants, pain relievers. Some increase alertness. Others disrupt sleep stages. Chronic conditions like arthritis, diabetes, heart disease, sleep apnea also interfere with sleep quality. This doesn't mean sleep problems are unavoidable. but it means sleep is often affected by multiple overlapping factors. Daytime naps and less activity. As people age, daily activity often decreases. Less movement gives less physical sleep pressure. Daytime naps, while helpful short-term, can reduce nighttime sleep drive. Shift the sleep schedule earlier. Make nighttime sleep lighter. This creates a cycle. Poor night sleep gives daytime naps, gives worse night sleep. What's normal and what's not? Some sleep changes are normal. Lighter sleep. Earlier wake times. Less deep sleep. But others are not normal. Severe insomnia. Extreme daytime sleepiness. Loud snoring with breathing pauses. Long periods of wakefulness every night. These may signal treatable conditions. Sleep loss should never be ignored just because of age. Why sleep still matters. Sleep remains critical at every age. Poor sleep increases risk of memory decline, falls, depression, heart disease, weakened immunity. Even small improvements in sleep quality can significantly improve quality of life. So why do older adults sleep less? It's not because they don't need sleep. It's because aging changes how the brain creates it. The clock shifts. Hormones decline. Sleep becomes lighter and more fragile. Understanding these changes helps us stop blaming ourselves and start supporting better sleep at every age. If you found this video helpful, like, subscribe, and stay curious, because understanding why is the first step to sleeping better.